Hi, my name is Dr. Renn. I'm going to be reviewing the lumbar spine disc injury home care instructions. These are the basic instructions we give all lumbar spine disc injury patients on the very first day we see them in order to get them to do some things that are going to help them at home. The first thing we tell patients is just about your body positions and movements. We like to have patients kind of vary their body position movements every hour. So we recommend sitting, standing, laying down, and walking. Just again, varying your position as much as you can, depending on where you're at or work or home. If you can do all of these, we recommend it. If you can't, then just do as much as you can. But the idea is not to get set up. Once you get set up and you're not moving a lot, then that swelling inflammation will sit in and it'll just be a little bit harder to get up and move after that. Plus the discs like a little bit of pressure on them. That's how they get their nutrients when they're being compressed a little bit. The other thing we tell patients is avoid flexing in any way. And this is like doing your dishes, brushing your teeth, getting dressed. Just avoid all that flexion. When that flexion happens and you're bending forward again and you're doing this, it puts a lot of pressure on those discs, and they can just cause more of that injury and less healing to happen. So we want you really to kind of be neutral with your spine, keeping a good upright posture with a good lumbar curvature going forward. Very important to do and maintain throughout the day. Next, for pain, we recommend doing some ice treatments. Ice will help decrease the pain because of the deepness of the tissue. It's not going to really act too much as an anti-inflammatory, but it will help with the pain. So during the first week or so, we say, hey, just do this one time an hour. And you can do it with sitting or laying down, and you're going to do that probably for about the first week. After that, patients start naturally kind of weaning off of this, and they do it a couple times a day. So if it's in the second week and they're over a little bit of that pain hump, we say just start kind of do it 3 times a day. Good question is how long should you put ice on for? And the answer is it's going to be depending on the strength of the ice, usually within this time frame here. But follow the acronym. First, when you put ice on, it feels cool, then it gets burns, and then it gets achy, and then it gets numb. And when it gets numb, it's time to remove it. If you don't remove it in time, then you risk getting some frostbite. And I've seen that multiple times with patients over the years. When it comes to other things that you should and shouldn't do at home, exercises and stretches, we recommend that you don't do any. And we're not saying don't do anything, just do what we tell you to do. That way, in the first week or two, while you're dealing with that painful disc injury, we won't be doing things that are going to aggravate it and only things that are going to help it. And we give patients specific guidance on their condition on what to do and what not to do. Some get a little bit of stretching, others get a lot more McKenzie. It really depends on how that presentation of that disc is happening and how much pain the patient's in. But we recommend don't do any of that. Get some specific guidance on what you should and shouldn't do for your specific case. Sleeping. Now, sleeping can be great for some patients and terrible for others. And what we usually find if they're in that acute phase of that disc injury is that sleeping on different surfaces throughout the night. Start in your bed, then move to the floor, and go back to the bed. Having a firm yoga mat on the floor sometimes is really helpful just to get that rest. It can be very painful at first, so we just want you to kind of vary those positions, try different surfaces, different beds, try to stay with firmer versus softer. And patients usually do better with that. And again, one of the things we tell patients, just avoid the stomach sleeping because it can really aggravate a disc. We find even with massage, when we have patients do massage here, we usually always start them off side lying because anytime the patient requests to be put on their stomach, it's like they can wake up or get up after the massage or after they're doing some electric stim, ultrasound, laser treatments, that they get a little worse. And so we always have patients lay on their side when we're doing any kind of modalities for them. And sleeping like that, good. You get a little bit of a pillow underneath your knees. If you're sleeping on your back, get that pillow underneath your knees to kind of remove some of that tension of those nerves. And again, if you're on your side, get a pillow underneath that top knee. Over-the-counter medications. Basically, our basic recommendation is take what works for you, and typically start with some NSAIDs. And we usually tend to find that they work a little bit better. Our recommendation for it is just take them only at night if you need to at first, because the pain will guide you during the day what you should and shouldn't do. And we want to see as a patient be comfortable during the day, but not overly take the medication, because that can mask the pain, and then they're going ahead and doing things maybe they shouldn't be doing and aggravating that disc a little bit more, and it just takes a little bit longer for it to fully heal. So how much should you take every day? Well, they say there's about 1,200 milligrams of like an ibuprofen or Motrin just to get that anti-inflammatory effect that you're looking for. But again, you need to talk to your pharmacist to see if there's any other medications that have some of that in it, so you're not going over that maximum daily dose of it. If you're not taking anything, you should be fine with that 1,200. However, you really should talk to your pharmacist if you're taking any other medications at all. Some supplements that we have patients love and have found helpful here are these. These are all Metagenics products. They've proven over the years that they work. MildCalm is a natural muscle relaxer. MildCalm PM has a couple extra herbs in it to kick in the sleep cycle. There's a lot of magnesium in these for that to help those muscle spasms, and a few other herbs in it that have been proven to work too. Again, MildCalm PM is just for people who are having trouble with sleep. And over here we have the pain and inflammation one, and that's in flavonoid. It's a product that's heavy in turmeric, which is a natural anti-inflammatory, and those really help to get rid of that inflammation at first. And these patients will take usually for the first 5, maybe 10 days to a week. Usually last about 5-day course for each one of these, but they do really help at first to kind of get over that pain hump. Getting over the pain hump is essentially what you want to do, and this is meant to do that. And then because it allows us to do more with you to get it to heal faster, and then strengthen things up so it doesn't happen again. Hopefully this is helpful to you, and let me know if you have any questions.